Hi, it's Dr. Kent Holtorf, owner of Holtorf Medical Group and of integrative peptides and other nonprofits like the National Academy of Hypothyroidism. And we started a program to treat veterans. And our first veteran I had the honor to treat, his name was Jesse. And he had been basically in Afghanistan, injured, traumatic brain injury, post-traumatic stress. He had basically a pole on his leg and had allodynia, couldn't even touch it. Terrible anxiety, terrible depression. And they found him face down, essentially pulseless, liver failure, kidney failure, heart failure, and they put him in an induced coma. And they said he's probably not going to make it. Well, he made it, and I'm not quite sure still how he ended up at our clinic, but we had the pleasure to treat him. And on the first visit, and when we do these trainings that we're launching, I tell doctors, you want to paint a whole picture. We can figure out what's going on. So we did probably 40 tests on him that he's never had, and it was amazing, what came back. By the second visit, dramatically improved. Third visit, he's up and he went camping, with no sleeping bag for 2 weeks. So heart failure resolved. He couldn't read previously. He can, sit down and read a book. Anxiety gone. He sleeps well, and just functioning. And one of the amazing things is that every vet we've tested has come back with 2 strains of Lyme, European and US, and most of them have co-infections as well. Not only that, and this is what we're finding, and we're finding with medicine, all these illnesses, we call them all these syndromes, and where it may be in neurodegenerative disease, and PTSD, and long COVID, and fibromyalgia, and chronic fatigue syndrome, they all have the same things in common. They have stress. Stress plays a big part. People downplay that. But, stress doesn't lower your immunity, it modulates it. Like, basically, it makes your immune system more aged in an illness phenotype. So it lowers Th1, gets stuff in the cell, and raises Th2, gets stuff outside the cell, causes autoimmunity, inflammation, neurodegenerative disease, senescence, immunosenescence, and it becomes a vicious cycle. And we find this with all these patients, whether, again, from autism to autoimmunity to these vets, and most of them have basically SEERs. Again, all syndromes. So we found stress, obviously, they have tons of toxins, chronic infections, which I talked about. They all have then a vicious cycle that occurs that I'll talk about. And they all of them, thus far, have antibodies against their brain, significant. We can use this data to treat them. We can reverse this. We can reverse their pans. And they'll basically have pots. They'll have pots and pans. They will, of course, depression, anxiety. They got brain on fire. Their brain is just so inflamed. So we'll do things like give them, BPC, delta sleep-inducing peptide, which lowers the inflammation in the sleep center. Epitalin is great, which modulates the immune system. You have to fix their immune system. We'll give them thymus peptide, and it stops that whole vicious cycle. Or normally, what happens is they end up getting mitochondrial dysfunction. And that makes everything worse, which then causes immunosenescence and senescent cells, which stop working and secrete more inflammation. Everything in medicine is a vicious cycle. So what we do when we see all these things, we're now able to unravel them. The big key is peptides, but we use, other things as well. And it's just so satisfying seeing these guys, what they've done and what they've done for our country. And the way they're treated, they're just given antidepressants, antipsychotics, pain meds, and just left to go and get better. And they don't get better. And it's horrible, but it's very treatable. And I can't tell you the nicer, I haven't met a group of nicer, most humble, stand-up guys. You know, we end up treating all these special forces guys, which I thought they're going to be all like in your face, like they're the opposite. And it's just such a pleasure to treat them. But so we're working with nonprofits to get funding for them. It makes me sick that the government isn't standing up, but we do what we have to do. So we've been working a while with the nonprofits to make sure they can get treatment for as long as they need, and they're getting better actually very, very quickly. But we're covering our bases, doing a lot of tests because we want to write up our review articles on this and publish the results, because we found some amazing things that people don't associate with post-traumatic stress. They just, oh, it's just all emotional, and all the burn pits, all the toxins, we're picking it all up. So we're putting all those pieces together. And, even things like the all cell danger response, that's just kind of looking at the elephant, one part. We're putting it all together and getting them better. And they're getting better, basically without exception. I'm very excited about it, as you can tell. And they're just the nicest guys. And I'm just feel blessed that I'm able to have the honor to treat them.